Listening to this video, you're very likely dealing with peripheral neuropathy, or maybe a loved one is. Maybe you're starting to wonder if you're developing it. Maybe there's a different way or a better way to go about approaching this. I'm here to tell you the mainstream approach to how this problem is being dealt with just isn't cutting it. The treatments are more so aimed at covering up symptoms while the nerves in your body continue to deteriorate and die. It's very similar to putting tape over the engine light when we're driving down the street and our engine light comes on, and instead of fixing the problem and taking it in and actually addressing the underlying problem, we take some tape and put it over the engine light so we don't feel the problem as it's continuing to get worse. And what I want you to know is there are other options to slow, stop, and even potentially reverse that neuropathy that's going on within you. And we do it by addressing the underlying problems, restoring how those nerves can function, restoring the blood supply into those areas so that those nerves can start to heal, provided the problem isn't progressed to the point where there's nothing that a person can do anymore. And that's why I really encourage people to take action today. What I can promise you is that if you make the changes we ask you to do in a year, 5 years from now, your life will be measurably better. We can improve your health. As to how much that we can improve, we don't know until we can actually get a chance to look at you and see what's going on with you. So, what is peripheral neuropathy, right? The pins and needles in the feet, the numbness and tingling in the legs, the pain in our feet, in our hands, right, as things start to progress, a burning sensation in those feet. Maybe we can't feel the ground beneath us, or it feels like gravel, or like we're walking on pincushions or walking on rocks. And then eventually it turns into things like loss of balance, amputation. The definition of neuropathy, right, or a condition or disease affecting the nerves. And peripheral meaning the ones outside of your brain, right? Meaning outside of your brain and spinal cord, so it's outside of that area. Very commonly starting in the legs. Mayo Clinic defines neuropathy as a chronic condition resulting from damage to the nerves located outside of the brain and spinal cord. This leads to weakness, numbness, abnormal sensation, and pain, usually in the hands and feet, eventually affecting other areas of the body, like digestion, urination, circulation, and can result in amputation, infections that won't heal, and other serious complications. That's why it's so important to actually change the course you're on, and the only way you can do that is by addressing the underlying reasons why you're developing it in the first place and implementing practices to improve blood flow, to improve nerve flow, not just cover up symptoms. And here's the thing, the medications they're giving you, generally speaking, don't even attempt to address the underlying triggers. So here's what I'm asking you to do. I'm asking you to commit the next 2 minutes of your life to listening. Turn off your phone. If you're watching this on your phone, right, turn off other distractions. Grab a loved one so they can watch it too. If you need to, hit pause, go to the bathroom, grab some popcorn, right? I want you to pay attention, right? And just give this some time, because this can be a fork in the road where if you choose to take a different route, it can literally mean the difference between a really great future and a very miserable. Peripheral neuropathy itself, more than 20 million people in the United States deal with it, and it's probably actually more than that. A lot of people just don't go diagnose, meaning they have it, they just don't know it. More than 100 different types of peripheral neuropathy itself, and those symptoms will generally vary depending upon what types of nerves are being damaged. There's 3 types, right? The sensory, meaning things that transmit information like pain, light touch, temperature. Motor, right, controls our muscles and movement, right? And then autonomic, meaning the part that controls how our organs work, right? The part that we don't think about every day. When we talk about this, most of neuropathies are length dependent. And what that means is that the longer the nerve, more likely that the damage or the deterioration is going to start. And that's why oftentimes symptoms start in the feet. And then it starts to affect other parts as the problem progresses. It starts to go up the feet, into the knees, right? Next thing you know, our hands and arms are being affected, and eventually our organs as well. The reason it starts there is because, again, those nerves farthest from your brain and farthest from your heart. Those nerves need blood supply, right, through those blood vessels to get to those areas so that they can function. And so if those different systems are compromised due to different underlying problems, deficiencies, or toxicities, that can start to contribute to that neuropathy itself. And there's very rarely just one contributing factor. There's usually many. Our job in our clinic is to help you to address as many underlying triggers as you can to slow, stop, and even potentially reverse that neuropathy. Yes, we do see people's sensation improve over time. Doesn't happen overnight. Nerves take years to actually start to heal. The research shows is we can generally gain about 1 millimeter of improvement per day. But again, that's kind of a vague thing because the nervous system is extremely complex and there's a lot of different factors that have to be looked at. The first one I'm going to talk about is sensory nerves, because that's probably the most common, right? Meaning our ability to feel things. So that's everything from vibration to cold to hot to pain. Those different sensory fibers start to be affected, and what we feel tends to start to change, right? It feels like maybe we have socks stuck between our toes. Maybe we feel like we're walking on pins and needles or walking on gravel, and we're actually not, right? We don't feel the different cold touch and things like that, which ultimately, if we can't feel the ground beneath us, it makes us prone to losing our balance, prone to falls and things like that, which is one of the worst things that an elderly person can happen is if they have a fall, right? They break their hip, and they end up, when I used to work as a nurse in the hospital, I would see that a lot where a person would break their hip and they would end up never making it out of the hospital because immobility, it would start to affect their lungs to be able to function, and they would end up with infections and things like that. So loss of sensation, that first area, and again, it starts in the farthest away from the brain, farthest away from the heart, and then it starts to travel up the legs and eventually affects the hands and things like that, and then starts to affect other areas as well. Second component, motor, meaning how we move, right? The muscles of our body, right? It manifests as muscle weakness, right? Maybe our legs feel really heavy, right? Or we have a hard time picking our feet up, right? Or we're tripping and falling over things. Painful cramping, right? Those nerves can cause problems in the nerves, can cause cramping, can cause muscle twitching, and then over time, muscle shrinking, or the technical term being sarcopenia, meaning muscle wasting, where those muscles start to deteriorate. Again, that's a really bad thing because we can preserve muscle mass, the less likely that we're going to have a fall that's going to end up injuring us. And muscle wasting is one of the things that we really don't like to see as a person ages because of how it affects every cell and our overall health. The last part is those autonomic nerves, right? The part that controls how our organs work. So excessive sweating, heat intolerance, ability to regulate blood pressure, digestive problems, or digestive systems, loss of sexual function or sensation in those different areas. The moral of that story, the big picture, is that you don't necessarily have to have pain for our nerves to be deteriorating. Again, and this is my biggest frustration, is that the mainstream approach to these problems never actually looks at addressing the underlying problems that would actually allow the problem to slow, stop, and even potentially reverse or restore function. One of the biggest problems, again, is falling. I've mentioned it a couple times. 1 in 4 adults fall over 65 every year. 37% of these falls basically cause moderate to severe injuries. The leading cause of injury related to death in ages 65 or older is falling itself. More than 50% of fatal falls involve those 75 or older. 1 out of every 200 falls results in a hip fracture for those over 65. And again, if your feet, maybe they don't hurt, maybe we just don't feel them. Again, that makes us prone to falling, and you guys, is a big deal. The next thing, amputations. As things start to progress, what happens is that tissue can't heal. If it doesn't have nerve energy, if it doesn't have blood flow, that tissue can't heal, and so we end up being more prone to infections, and that can end up as an amputation. We've all seen it, right? That neuropathy ending up in losing loss of toes, loss of feet. 150,000 people every year in the US alone undergo lower extremity amputations, most commonly due to diabetes, peripheral artery disease, neuropathy, and trauma. There are over 100 different causes of neuropathy. I'm definitely not going to cover all of those tonight. Some of the most common: diabetes, trauma, autoimmune problems, meaning a problem with how your immune system is reacting to the tissue around it, hormonal imbalances, and you guys, these are all things that we deal with in our office every day, okay, that we help people to address the underlying triggers that lead to these different problems. Kidney and liver problems, alcoholism, nutrient deficiencies or nutrient depletions, or vitamin imbalances, toxicity, different toxins that will literally destroy your nerves or your blood vasculature over time. Things like radiation, chemotherapy, right? Different medications. Medications are one of the most common causes of neuropathy itself. And then there are hereditary factors, and then different infections. So I want to get into a little bit about the approach that we want to take and when we look at it. So we've covered a little bit about what neuropathy is. Now what I want to get into is how our approach is going to be different than probably what you've had or many other approaches, or the general approach to neuropathy in the mainstream medical approach. And I'm going to use an analogy, right? I want to picture your body like a house. Let's say we have a fire in our house and that house is burning. Who are you going to call? We're going to call the firefighters. Generally speaking, don't call a carpenter. We consider ourselves carpenter. We consider the medical world the firefighter. Call the firefighters, have them put out the fire. That's if your body has a trauma or you're a car accident or something very serious in a crisis mode. That's what medicine's really good at. But what medicine is a dismal failure at is actually restoring function and making sure that you're building and maintaining a good, healthy body. So once that fire is out, it'd be like the firefighters saying, hey, let us manage the health of this house. Let us keep pouring water on it. Let us keep using our axes and fire hoses, those drugs and surgery, every day for the rest of your life. Especially if you're a carpenter like myself, we look at the body like a carpenter will look at a house. Where the firefighters are saying, hey, we did a great job. We put out this fire, even though all these things are wrecked, right? The pictures on the walls, the walls are ruined, the carpeting, everything's going to need to be replaced. As a carpenter, the carpenter is saying, man, we got a lot of work to do in this place, and we got to get it cleaned up. We got to fix the electrical system. We got to fix all these different areas. That's the approach that we take. We look at the human body like a carpenter would look at a broken down house. And so that's where when we start to deviate these different routes, once neuropathy is diagnosed, what are people typically told? The things that people tell us in our office, they say things like, my doctor said there's nothing that I can do about it. It's only going to get worse. You're not young anymore. It's just a process of aging. I don't buy any of that. And the reason I don't buy any of that is because we see people that the problem hasn't already progressed to the point of no return, where we see people restore function. We get to see that. So that's where I know beyond a shadow of a doubt that the idea that there's nothing that can be done is simply not true. So I don't want you to buy into that. I want to provide hope for you that there is something that can be done. If they say that there's nothing that can be done, then their main goal is to manage symptoms, right? The pain, tingling in the feet, the different symptoms that are happening as the problem continues to progress. In fact, many of the different medications that tend to go along with neuropathy can potentially make neuropathy even worse and speed up that degenerative process. Many of them also will cause your brain to age faster and other problems as well. But here's the thing. It's not their fault. They're thinking like a firefighter because they've never really been taught to think like a carpenter. In our world today is because the treatments aren't aimed at addressing the underlying problems. The treatments are more so aimed at covering up symptoms while the nerves in your body continue to deteriorate and die. After a person is diagnosed with neuropathy, they're typically referred to a neurologist, where the neurologist uses more medication. That's the typical route. Now, I'm going to get into some of the different medications, and most of these were never developed or intended to treat neuropathy itself. Typically, your gabapentin, antidepressants, NSAIDs or non-steroidal anti-inflammatory drugs, ibuprofen, again, pain medication, opioids, nerve blocks, lidocaine patches. You guys, these are all designed to decrease sensation, meaning you don't feel it as much while the problem continues to progress. All of them have side effects and do not stop the progression of neuropathy. Chronic use of gabapentin causes a significant increase in degeneration of the neurons in the hippocampus part of the brain involved in many functions, including long and short-term memory, spatial memory, working memory, and effective learning. The study also goes on to say it can cause neurodegenerative changes in the adult brain. What that means is it makes your brain age faster, your brain degenerates, so things makes you prone to brain problems. Another very commonly used medication is Neurontin. And Neurontin was actually one of the medications that Pfizer, the drug company that makes it, was actually fined. And the reason they were fined is because they were using the medication. They were basically saying this medication had benefits, to which there was no studies that could actually prove that. And they also talked about they were suppressing negative data that showed no benefit, and they hid those research studies in order to get their medications used by other people. Your NSAIDs, non-steroidal anti-inflammatory medication. I hope you're getting the point that there are definitely downsides to these medications, oftentimes that we're not ever really taught about, and that if possible and if we can do it, we'd love to see people be able to co-manage and work with their medical provider to help to get off these different medications as we restore function so that the person doesn't need these. The next thing that I talk about here is the alternative medicine world, right? Where you'll see an ad on Facebook or you'll see this ad and it says, hey, do this simple treatment, take B12 or take some magnesium or take this different magic lotion potion that's going to help to take all your problems away. And I love the intention of it by using a non-drug approach, and oftentimes it can help to a degree with different symptomatology of neuropathy. But at the same time, if we're not addressing the underlying problems, we're going to be losing that battle. And so looking at things from a comprehensive approach, meaning looking at things from the big picture down and getting your body as much of what it needs to help to start to restore that nerve function, is so vital, so that it takes the guesswork out of it of saying, hey, I tried this medication, I tried this supplement, I tried, there's all these thousands of different options out there. We want to make sure you're getting what you need. And that's where we talk about our approach, is where we talk about we test, we don't guess, number one. Number two, we put together comprehensive programs that address the multiple different areas. That's where we talk about our Swiss watch principle, because there's rarely ever just one thing. So a person says, hey, I'm taking B12, but it didn't help. Well, maybe you needed B12, but maybe you needed 8 other things at the same time. Maybe we need to fix your cardiovascular health. Maybe we needed to help with blood flow to those areas so that the different nutrients that you're taking can actually help to work. So we look at this body like a Swiss watch, where there's multiple gears on that Swiss watch, and if one of them goes wrong, it can affect the function of the entire watch. Same thing with the human body. If there's one area that's not functioning like it should, it can affect everything else. When we look at this, right, we want to get to those underlying causes. And so basically what that means is doing a thorough evaluation, getting some lab testing. Some initial lab testing is probably not everything that a person needs indefinitely, but it gives us a good area of where to start. The biggest cause of neuropathy itself is diabetes, but again, there's over 100 different causes. Everything from spinal problems, right, to what we call vertebral subluxation complex, autoimmune problems, thyroidism, obesity, chronic inflammation, right? Toxicity and deficiency, meaning are different chemicals in the human body toxic that are creating a problem, or are we deficient in certain nutrients? I mentioned B12 a little bit before, your omega-3s. There's different nutrients that your body needs, and if it doesn't get them, those nerves are going to want to break down. And then medication toxicity. There's a laundry list of medications that will contribute to neuropathy. I'm not going to cover all that stuff intensively here because we'd be here all day, but I'm going to cover some different highlights of that. The number one reason we develop neuropathy is being diabetic. And the thing about being a diabetic is you might not even be diagnosed with it yet, but the process of diabetes is said to take anywhere from 10 to 20 plus years to develop. And the problem with that is the different effects on your nerve system are happening while you're developing diabetes itself, even before you develop a full-blown diagnosis of diabetes. 40% of Americans are expected to develop type 2 diabetes in their lifetime. 1 in 11 adults have diabetes, and about 40% are pre-diabetic, which means about half our population is either diabetic or pre-diabetic. You guys, these numbers are out of control. That one, right, which is something we are really good at in our clinic, is helping your body to reverse the underlying problems behind diabetes, things like insulin resistance and inflammation, things that worsen diabetes, and help to get off the different medications, help to co-manage with your other practitioners to help to get you off these different medications, like cholesterol medication, which can worsen both insulin resistance and diabetes, as well as worsen neuropathy itself. So if you're taking a statin, that's a huge red flag, and that should probably start addressing and questioning whether a person should be on this for the long term, and what can we do to help a person to get off that. And again, we don't recommend anybody make medication changes until we've had a conversation and all that good stuff. And so these are just things to think about. Blood glucose, right? If your hemoglobin A1C, which is a measure of your long-term blood sugars, is over 5.5, your brain and your nerves are being negatively affected. There's a correlation with the higher your A1C goes, the more likelihood and the more severe Alzheimer's, which is the deterioration of your brain tissue over time. So something that's very important to address. Again, something our clinic is really good at helping to address. And this is where there is actually plenty of research out there that talks about the importance of helping people before they ever develop both neuropathy and diabetes itself. So you guys, there's a number of different things when we look at helping to reverse insulin resistance, that underlying problem. And one of the big things, and we can show it because we do pre and post tests, meaning we test for the reasons why you're developing diabetes, we test for how bad it is, And then we actually help to address the underlying reasons why a person develops it. And so take a look at the gentleman. This is just one of many different people that we've helped. In fact, our success rate is rather high at that, at helping to reverse those underlying problems, get people off their medications while actually normalizing their blood sugars, getting their A1Cs down to where they should be, getting the other very important lab markers down to where they're within healthy ranges. And that's when one of the big things that you can do to help to heal yourself. And one of the other big important aspects of neuropathy and helping to address those underlying problems is nutritional deficiencies, and that many of these can be caused by digestive problems, and even the medications that we're using to help with digestive problems. People that are taking things like reflux medication, they're called proton pump inhibitors, are more likely to develop peripheral neuropathy because of the effects that they have on the human body. There are many of them. I'm not going to cover them extensively here, but again, if you have problems in the digestive tract, you can definitely develop a B12 deficiency. And also a lot of really great research that talks about how the gut microbiome, or how your intestinal health is, and how that regulates neuropathic pain, or pain in peripheral neuropathy pain itself. So a person can help with neuropathy just by improving their digestion, how their body's digesting and breaking down foods. If we need to, that is one of the areas that we're really great with testing, things like food allergies that affect not only our digestion, but inflammation throughout the body. Doing what's called microbiome, where we look at the digestive tract and look at the different aspects that affect health of the digestive tract, and then testing appropriately and helping to heal it appropriately as well. I'm not going to say that we do that with everybody by any means, but if there are indications that we need to look at that, we definitely do. Omega-3 deficiencies. We've already heard of omega-3s, but making sure your omega-3 levels are what they should be. And that's one of the things that we see very often is when we test for omega-3 deficiencies. These people with peripheral neuropathy have very significant deficiencies or imbalances in those omega-3s. We look at another potential contributing factor is things like heavy metals, right? We talked about toxicity, things like aluminum, mercury. These things, when they're toxic in the system, can cause neurodegeneration, or the breakdown of our nerves. And so again, by testing, we know if it's there, if we need to get rid of it. We don't do that with everybody. Again, it's if those cases just aren't progressing. The health of our spine is an extremely component of our overall health and how that neuropathy progresses. The spine is very intricately connected with the nerves and the peripheral nerves, because obviously the brain sends signals down through that spinal cord and then out, particularly that low back, what they call lumbar or sacral area, that those nerves go down into those legs. And if there's impingement or problems in those different areas, that can definitely affect the health of those nerves. And so different traumas, falls, where we have those accidents and hurt our low back, can be something that 5, 10, 15, 20 years later, we start to develop neuropathy in those areas. And so addressing that trigger and addressing that stressor, what we call it, is really important. And we do that through a combination of different modalities in our office, whether it's chiropractic care or something else. So what does this carpenter approach look like? And that's probably the most exciting part about it, you guys. And here's where it comes down to it. I started helping people with peripheral neuropathy because one of my passions is helping people with their cardiovascular health. My grandma lived the last 10 years of her life in misery. And I specifically remember an event in my life where I was home for a funeral and I was visiting my grandma, and my relatives were all there, and she was just recovering from her second heart surgery. She had 2 spine surgeries already, and she was just exhausted, confined to a walker, confined to a wheelchair, always in pain, always out of breath. And she came from her walker back to sit down, and she sat down and was catching her breath. And she looked me in the eyes and she said, "You know what, Steve?" She said, "If I could have done one thing differently, it would have been to take better care of myself before it was too late." The place became silent. And her next phrase changed my course of my career forever. She said, "I wish I wouldn't have lived through my first heart surgery." You guys, she'd been miserable every day since. I got on that airplane knowing what I needed to do with the rest of my life, and that was to help people to slow, stop, and reverse this chronic disease, and to help people as soon as I could before it was too late. You guys, and here's the thing. If we get in and we can help you before it's too late, before all sensory input is gone, that's kind of the last part of where we can't help people, is if you have no feeling left whatsoever when we get into your examination. And if we do find that we can help you, our typical improvement over the course of a 12 to 18 months is anywhere from a 30 to a 70% improvement in that function. So when we look at this, we start out with a thorough case history. I want to know what other contributing factors, lots of questions that you might have for me, lots of questions that I'm going to have for you about what's going on with you, so I know better what I need to do to help you. And then if it's pertinent at that point, we may order some additional lab testing, we may not. Just kind of depends upon what that conversation looks like. And then we get in and do an evaluation, you guys. And this is where we want to see how severe it is. We want to see what parts of that nervous system and blood circulation to those areas are being affected. Our two main huge goals for the short term are to improve nerve health to that area, to the legs, right, or to wherever we're working on that neuropathy, and then to improve blood flow to those areas. So looking at intensely what we need to do there. And then getting in, helping with food, nutrition, and lifestyle. The more you can do on that side, the better off you're going to be. Don't have to do everything, but the bare minimum, getting rid of some of the big triggers are really important in ensuring long-term progress. And then once I have a good picture, we may look at some x-rays, may want to look at what that spine looks like, how much problems in the spine, and if we can help in that area. If you're close enough where we can help you, if you're coming from 2 hours away, then maybe we find you a clinic closer to where you're at, take care of that component of your health. But having a good picture of what we're looking at is vital in helping to know what we need to do. Now, look, when we talk about that examination, what does that entail? Obviously, your case history, you want to know a lot about what happened, when it started, all that good stuff, different contributing factors, what medications you're on, all that sort of thing. We do your sensory examination. We check for muscle strength. We check balance. Is your balance being compromised? And then we look at different aspects of sensation, like light touch, like cold, like hot, vibration, and how severe is it, so that we know, and then we can measure 3, 6, 12 months later to see where your body's at, to see what sort of progress you're making. And we do see measurable improvement in that sensation. And that helps us to know that we're winning that battle, that we're actually reversing those underlying problems. Because if your sensation is actually improving, we know that those nerves and that blood supply are actually starting to improve, which ultimately means that there's a very much less likelihood of having to have the amputations and the long-term problems with the neuropathy itself. 5 key steps. We want to improve nerve function and healing, improve blood flow to the nerves and the tissue. We want to stimulate tissue for improved function, help reduce overall inflammation, and there's degrees of that as well. And then address those underlying triggers. That's a long-term one. That doesn't happen overnight. That's where, if your goal is to continue to work on those underlying triggers, we can continue to help you with that with our health coaches, with myself, to help to continue to improve that with our chiropractor and some of the different procedures that we use in the office. Many times people will say, hey, well, Dr. Steve, what do you do? What does the actual protocol look like? And I can tell you it's probably somewhat different for everybody. But again, the different technology and the nutrition and the different things that we're using are all designed to improve blood flow, decrease inflammation, increase nerve health over time so that you have the best chance, and then to put it all together in a package to actually move the needle in the right direction for you. So again, when you think about what you've been taught to do or told to do up to this point, I think by now it's probably making sense that no one's really attempted to address the underlying problems and reverse these different processes. Are they looking at those different 5 steps, or are they just throwing medication at you to help you to feel better while this problem continues to deteriorate? So we have 3 different options when dealing with this neuropathy. You can do nothing and it will get worse. Stay on the medications you're on, you'll feel okay, and maybe you don't feel okay, but it will get worse, and that's pretty much predictable. You can go to our medical doctor or neurologist who will basically give you more medications, or that third option is to put yourself on a different path. And this is the thing. Changing that path is going to change the outcome for your future. So I want to invite you, if you're looking for a different route for this, don't wait to make an appointment. What oftentimes happens, say, I need to do this, I want to do this, I'll do it tomorrow, and then we forget. And then a year from now, 2 years from now, you're wishing that you would have done something before it was too late. So I want you to set up an appointment. I would love to have you in the office, see if I can help you. Here's the thing to know though. Our main goal in that first visit, is to get you tested appropriately, so we know what we need to do. I'll know if I believe I can help you, how much does it cost, and will insurance cover it? And here's the thing. Insurance, for the most part, will not cover what it takes to get healthy. And here's the thing. You've been doing what insurance has been paying for up to this point, and the problem's been getting worse, or at least it's not getting any better. Medicare guidelines specifically say a treatment plan that seeks to prevent disease, promote health, and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. And so this is the brass tacks, is Medicare doesn't help to pay for what you need to heal, and they say it right in their guidelines. Essentially, we call it I don't care, not Medicare, I don't care, right? It says it right in their guidelines. They don't pay for what it takes to actually get healed. What that first appointment entails is consultation with myself or one of our other practitioners to figure out more about you. We want to know you personally, want to know what you got going on, and if there's any complications where we think maybe we can't help you, and have a better idea of what we need to do to help you. Review of what you've done in the past. We want to do that assessment where we look at examination, we take the x-rays, looking at what you got going on there, looking at, do we need to change nutrition? Where do I feel like we need to start with that? And give you some really simple things to start with until we have a chance to get in and really start digging on that realm. And then essentially look at what sort of testing do we need. It doesn't include the cost of the testing, if we are needing to do testing with you specifically. And then a case report, a follow-up report. Once I have a good picture, we have your neuropathy examination. If we need to do a chiropractic evaluation, we do that too. The x-rays, based upon everything that we find, we go through a case report where we go through what you got going on, what's working, what's not working, and then I give you my recommendations. Now, I want to let you know, and this is where it's extremely important to have a loved one there for those first 2 visits, because you're going to want somebody else there, because we cover a lot of information. So it's 2 people to hear what's going on with you, as well as you're going to be making some important decisions. And again, this insurance won't cover it. And so what you're looking at from a financial perspective is anywhere from probably around $3,000 to upwards of, the more severe or complex cases over the course of 18 months or so, anywhere from $3,000 to upwards of, $10,000 to $15,000. Again, that's kind of the exception when there's a lot of stuff going on. And so I do want you to have an idea of that, but I want you to think about what things look like if you don't. You can't take that money with you. And so again, don't keep waiting until it's too late. Set up an appointment today. I want to thank you for your time and looking forward to meeting you.